Good morning to everyone. I'm Dr. G. Monika from the Department of Public Health Dentistry. Today I'm going to discuss the topic on atraumatic restorative heart treatment. So these are my contents: introduction, principle, instruments, stepwise ART approach, and conclusion. So, introduction. So, atraumatic restorative treatment is a procedure is based on removing the caries to tissue using the hand instrument alone and restoring the cavity with the hand vessel materials. So, the ART does not require any electrically driven dental equipment, and the caries cavities can be treated almost every way. So, what is the benefits from ART restorative treatment? It can be done in remote communities with no dental services, towns and villages without electricity, housebound elderly living in nursing homes, and physically or mentally handicapped. And there are two main principles of a traumatic restorative treatment is removing the caries to tissue using hand instrument only and restoring the cavity with restorative material that stick to the tooth. The reason behind using the hand instrument rather than electrical rotating handpiece is it is an most biological approach which requires minimal cavity preparation and conserves the sound to tissue, causes less trauma to the tooth, and a low cost of hand instrument and simplified infection control. So the instruments used are mouth mirror, explorer, pair of tweezer, dental hatchet, spoon excavator, applier, garver, glass slab, paper, mixing pad, and spatula. The materials are cotton wool roll, cotton wool pellet, clean water, glass ionomer, restorative material, deep denting conditioner, petroleum jelly, wedge, plastic strip, and articulation paper. And these are the instruments. And for restoration of the cavity, glass ionomer cement is used, which consists of powder and the liquid. So the main advantages of indication for using a traumatic restorative treatment is only it can be used only in small cavities involving the dentin and in those cavities that are accessible to hand instrument. In case of public health programs such as camp settings, in uncooperative earful patients or the patient with special healthcare needs, and it is contraindicated in the presence of swelling or fistula near the caries tooth or the pulp of the tooth is exposed or the tooth have been painful for a long time and there is no obvious caries cavity or the but the inaccessible area of hand instrument. So now we are going to study in detail about the procedures. So the position of an patient is provided when the patient is lying on a back of flat surface, which should provide a safe and secure body support and comfortable and stable position for lengthy period of time. And headrest is made firm or a rubber ring with the cover with both stabilize the patient heads in desired position and improves the comfortable patient, which is shown below in a picture. Next, in case of treating a children as special assistant is required. So the stepwise approach for atraumatic restorative treatment is isolate, practices, exhibit, resheet, restore, stress, and remove the exercise. First comes the isolation. The isolation is done with an cotton pellets in order to keep the feed of the cavity free from saliva. Next comes the accessibility is done and in which we connecting to the from the wet to the to remove any debris where and remove any excess of saliva is present inside. Next comes the we should remove the fractured or unsupported enamel with an enamel hatchet and we should use the excavator in the circular and splitting motion to remove the carious tooth. So the dental hatchet is used in a circular and splitting movement for excavation of dental caries. Next, application of a dental conditioner. and restoring the tooth with an glass ionomer cement. And we should check for the occlusion. And after restoring the tooth with an glass ionomer cement, we should press the restorative material with an gloved finger. If excess material is visible, the removal of excess material with carver or a blade or applicator can be removed. So the removal of the after pressing with an gloved finger, the excess material is visible and the excess has been removed. So, to conclude, ART is maximally preventive and minimally invasive approach to stop further progression of dental caries. ART as an additional means of providing a gender to the public. This technique has a potential to make oral health care more available to larger part of the population than before, and it it has also an although dental caries are substantially discrete in industrialized countries, it remains to be widespread problem overall the world. So the ART procedure has been developed to focus on such group of people who are unable to attain the dental care. So ART should not be undertaken in an isolation. Should not be undertaken in isolation. It should be an integral part of comprehensive package of healthcare. Thank you.